We're looking to introduce another level of PPE to be used on codes. This is a full face mask that has a P100 filter. The rating P100 shows that it can filter down to 99.97% of particulates down to the 0.3 micron level. The P just denotes that it's resistant to oils, which doesn't mean a whole lot to us, but knowing that these actually filter better than N95 masks. These are a higher level of protection. The full face piece obviously gives you better eye protection as well. So during codes, the individuals that are going to be directly involved in working the code, for now there's going to be 2 on each rig. So the 2 that are on their hands and knees actually working the code, the 2 closest to the head of the patient, should be wearing these during codes. So I'll just show you how these filters spin on. These are reusable. We can reuse these until they're difficult to breathe through, and that should mean possibly dozens of hours of breathing. So the way they work, they just screw on the bottoms here, 2 on each mask. Just simply spin them on. Of course, if I'm going into my P&B scenario, I'm going to have my gloves on, I'm going to have my coveralls on, Tyvek coveralls, and I'm going to then go ahead and show you how to don this.
Okay, after the code, when I'm ready to doff my face mask, it's important to remember to clean your hands, so you can use a soap, clean them really good. Now you're going to remove the hood.
Remove the mask. And it's important to remember that this entire mask could have been exposed to the virus. Okay, so you have to be very careful handling it from this point forward. I'm going to show you how to decon the mask and what we're going to do with the filters to get them ready for the next use. So the mask we're going to use, we're going to hand out these. You should have some at your station already. We're going to give some extras. This will kill the virus. Just follow the directions. Mix 2 gallons of solution basically. Mix this with 2 gallons of water. These filters cannot be exposed to any water, blood, body fluids. If that happens, they're garbage. So in order to store these properly, we're going to use the paper bag technique. Clean paper bag. We're going to go ahead and spin these off. This is after every use in the field. Take it, try to get it in the bag without touching the sides. Okay, and then we're going to have our disinfectant solution. Go ahead and dunk the mask just like your SCBA. And then you're going to dunk it in water, hang it to dry. You can use a soft cloth to kind of dry it off if you need it quickly in between calls. That's about it as far as deconning the mask. If at the beginning of your shift, as we use these, we'll find out more. We kind of trialed them. Didn't get any fog inside, but if you do tend to have problems with fog, you're also getting as part of your kit this anti-fog spray. Go ahead and spray. You just have to do the inside of the mask. A few sprays, rub it around, and then kind of lightly buff it out so that it's clear again. This will prevent any fogging. But again, wore this outside in the cold, brought it back in, had it on during, we kind of practiced some innovations on the mannequin, and I never had any fog problems. But if you get to that point, go ahead and use that. So we've hung dried that. Now when we need to go use this mask next time, you're going to want to put on clean gloves and remove these filters from the bags, reapply them to the mask, and once you've done that, you have to remember that these are always considered to be dirty after that. So anything that touches these could be infected with the virus. So after you put them on your clean mask for the next call, be cognizant not to touch them. Just put them on, change your gloves, and then actually go ahead and do that. Let's say I got them both on. I have my gloves doubled up so I can just pull these off. But if you're going to a new call, you put new gloves on. Don't touch the filters, and then go ahead and don the device and put your coveralls over that. So again, these can be used over and over and over again until they're difficult to breathe through. The last thing that I did want to touch on is that when we did practice with these, it didn't seem to inhibit my ability to intubate the mannequin whatsoever. The field of vision actually is so great that you can't even see the mask when it's on. The only thing that obstructs your vision is a little bit of the filter here towards the bottom of your vision, but you can't see the, sorry about that, you can't see the mask in the top of your vision or the sides, but we are going to recommend to go ahead as soon as you get these at the station, put them on, play around with them, get out your intubation kit, and just kind of practice a little bit. But I don't foresee any problems in this making intubations any more difficult. Alright, the last point that we want to touch on is if you do end up getting a resuscitated P&B and you need to transport to the hospital with these on, obviously we won't be able to make a bucket of disinfectant cleaner to dunk them in, so you have to do an initial cleaning at the hospital. Just take any disinfecting wipes that you have in the med rig. These Lysol type ones work great. Go ahead and wipe everywhere you can, every surface obviously as good as you can. Just to get it back in service, and then as soon as you get back to the station, you should still make that bucket of disinfectant and dunk it to make sure that everything you couldn't get with these is completely cleaned off.